Bismillahirrahmanirrahim. Welcome to the course. I'm Fawad Ali, Assistant Professor, Department of Pharmacy, Part University of Science and Technology. Welcome to the course Pharmacology and Therapeutic. Today we discuss about the poisoning and overdose. This is the third part of toxicity. Outlines like what is poison and overdose. We discuss general assessment of the poisoning, specific medical questions, sign and symptoms of the poisoning, management, drug toxicity like paracetamol and aspirin overdose management. After watching and listening, this student will know about the poisoning and its management. The adverse effect of the what is poisoning? Like what is poisoning? The adverse effect of the plant and food, chemicals or pharmaceutical agents on the body. What is overdose? The poison by the excessive doses. So the poison or the overdose may be accidental, like patient, like mostly in like the children under 6 years, or they accidentally take some medicine. They don't know about the strength, etc. Or deliberately some do or take the medicine in high quantity, especially in suicide or in some reactions. So there are two types. They may be accidental or deliberate. Like two peak ages group. The first group is toddler to preschool age. Um, when children are exploring the environment. The second group is young adult age group when ingestion is the form or suicidal behavior. General assessment like management of poison is a primary support, is a preliminary support like basic life support, level of consciousness, airway, breathing, circulation, pulse, hemorrhage, skin color, skin temperature, skin condition, and redness, and blisters. History: when, what, how much, why, circumstances. This is like when you take, what are the situations, how much, why, and circumstances. Drug history is also important. Psychiatric history, if they hear some like hear some psychiatric drugs or not. So psychiatric history is very important. Assess mental status and capacity. Specific medical question like poisoning and overdose history, like substance, when exposed, ingested, amount of the poison or the toxicant, time period, interventions, and estimated weight. So, like poison or history, like what is the substance when exposed or ingested, amount of the ingested poison or the toxicant, time period, how time, like the time period, and the interventions and what are the estimated weight. So we are having like for example going for the simple sample history. Sample mean as for sign or symptom. What is the sign or symptoms of the patient? Like sign or symptoms of the patient. So allergies, for allergies, medications, pertinent medical history, last oral intake, events, initial symptoms of poison like pain, fluid imbalance, water and electrolyte imbalance, acidosis, body temperature dysregulation, malnutrition. Okay, sign and symptoms of the poison. They have different sign and symptoms like on different systems like on CNS. Different toxicants have different side effects. For example, some causes convulsions, some causes coma. Like for example, if you are going to have excessive dose of a sedative hypnotic coma, and that may occur. Convulsions are normally if you take some hyperexcitability are seen as stimulant drugs like glutamate, relevant, etc. So it may causes convulsion, hyperactivity, delirium, mania, hypoglycemia, hypoxia, and depressed respiration. Maintenance of adequate airway, oxygen administration, pulmonary edema, circulatory system environment like circulatory system failure or shock, congestive heart failure, cardiac arrest, genitourinary tract involvement like acute renal failure, urine retention, GIT involvement like vomiting, diarrhea, abdominal discomfort, distension, flatulence, blood and hematopoietic system involvement like methemoglobinemia, agranulocytosis, another blood dyscrasis, hemolytic reactions. General comments: try and get as much as history as possible, including the witness. People truly wanting to commit suicide often lie. Like they are lying. Like remember the ABC: airway, breathing, circulation. Like airway clear the mouth and throat. Gag reflex, breathing, oxygen saturation. ABG, arterial blood gas. Circulation, venous excess. IV fluid if shocked. Examination. Investigation: always check the blood glucose. Send blood and urine for toxicology screening. Check the blood glucose. Send blood and urine for toxicology screening. Always measure the paracetamol and salicylate levels. Failure to diagnose, treat it negligent. Urine and excretion, LFTs, renal liver function tests, glucose, ABG, clotting, bicarbonates, ECG, chest X-ray, specific blood levels should be checked in order to maintain the in order to have a better management. Like first we are giving the supportive care like correct hypoxia, hypotension, dehydration, hypothermia, and acidosis if there. Control seizure, monitor total peripheral resistance, blood pressure, ECG, oxygenation, general absorption, decrease absorption, increase elimination. This is also one of the strategy like decrease absorption, increase elimination, and specific antidote. Gastric lavage only if within was first hour and life-threatening amount, never for the corrosiveness. This is by decreasing the absorption of the toxicant. Activate charcoal 50 grams single or repeated dose to increase elimination. Does not bind heavy metals and ethanols and acids. Second strategy is to increase elimination. Multiple dose activate charcoal like quinine, phenobarbital, charcoal, hemoperfusion, barbiturate, theophylline, diuresis, like urinary alkylation, salicylate. For urinary alkylation, for salicylate, urinary alkylation is necessary, and dialysis. Okay, drug toxicity. Drug also have a toxicity like paracetamol, salicylates, CNS depressants, CNS stimulants, antidepressants, and digitalis, and organophosphate, phosphate. Paracetamol overdose, acetaminophen, most common allergic drug taken in overdose, often found in combination with antihistamine, codeine, few symptoms or early signs. As little as 12 gram can be fatal. In some books, the 6 gram, like 6 gram, can be fatal. Hepatic and renal toxin. More toxic is liver enzyme induce or reduce ability to conjugate the toxin. Tablet dissolve rapidly. Peak level 3 to 4 hours after ingestion. May be delayed in the presence of other drugs, for example antihistamine, anticholinergic, and opiates. Volume of distribution approximately 1 liter per kg. Ingestion of 200 mg per kg, 200 mg per liter. Estimated blood level. Elimination half-life normally 1 to 3 hours, increased to 4 to 6 hours or more after overdose. So the paracetamol toxicity clinical evaluation, serum paracetamol level, acetaminophen protein calories, malnutrition is best predictor if available. Level associated with the probable toxicity. 200 mg per liter at 4 hours after acute ingestion. 100 at 8 hours, 50 at 12 hours. Like acetaminophen is metabolized by, like for example 50% are metabolized through phase 2 conjugation like sulfation. They are non-toxic and excreted, and 45% are excreted in the glucuronidation. in phase 2, they are also non-toxic. Some part only are secreted are metabolized by the cytochrome P450 system and forming the NAPQI, N-acetyl para amino isoprene, uh, which is a toxic compound which causes liver and kidney damage. Causes liver and kidney damage. So they are normally body have glutathione, so they bind with the NAPQI and they they become non-toxic product in combination. But if the glutathione level is saturated, then we use N-acetylcysteine as an antidote for the NAPQI. So N-acetylcysteine supplies glutathione. Doses for the NAC N-acetylcysteine infusion adult 150 mg per kg IV infusion in 200 ml 5% dextrose over 15 minutes. Then 550 mg per kg IV infusion in 500 ml 5% dextrose over 4 hours. Then 400 mg per kg IV infusion in 1000 ml 5% dextrose over 16 hours. Side effects are like rare flushing, hypotension, wheezing, or anaphylactic reaction, but they are rare. Alternative is methionine orally